Welcome to Men's Health 365, where we explore evidence-based strategies to optimize your health, vitality, and sexual function. After 60, I'm your host, and today we're covering a topic that causes unnecessary anxiety for many men: your first visit to a urologist. If you've been referred to a urologist or are considering making an appointment for issues like erectile dysfunction, urinary problems, prostate concerns, or other men's health issues, you might be feeling nervous, embarrassed, or unsure about what to expect today. I'm going to walk you through exactly what happens during a typical first urology visit, what questions you'll be asked, what examinations might be performed, and how to prepare so you can approach your appointment with confidence rather than anxiety. Knowledge eliminates fear, and understanding the process will help you get the most out of your visit. Before we dive into the details, let me share Richard's story. At 65, this high school teacher from Miami had been experiencing progressively worsening urinary symptoms for over 2 years: weak stream, frequent nighttime urination, urgency, and occasional difficulty starting urination. His primary care doctor had recommended seeing a urologist multiple times, but Richard kept postponing the appointment. "I was terrified," he admitted when he finally came to see me. "I had all these fears running through my mind. I imagined painful procedures, embarrassing examinations, and being told I had cancer. I put it off for so long that my symptoms got significantly worse. Looking back, I realize how foolish that was. The actual visit was nothing like I'd imagined, and I wish I'd gone years earlier." Richard's experience is incredibly common. Many men delay necessary urological care due to fear of the unknown, and this delay often allows treatable conditions to progress unnecessarily. Let me walk you through exactly what happens during a first urology visit so you know precisely what to expect. The visit typically follows a structured format that includes medical history review, symptom discussion, physical examination, diagnostic testing if needed, diagnosis and treatment planning, and follow-up scheduling. Let's break down each component in detail so there are no surprises. The medical history review. Your first urology visit begins with a comprehensive medical history review, typically conducted by a nurse or medical assistant before you see the urologist. You'll be asked about your current symptoms in detail: when they started, how they progressed, what makes them better or worse, and how they're affecting your quality of life. Be prepared to answer specific questions about urinary function, including frequency of urination during the day and night, strength of your urinary stream, any hesitancy or difficulty starting urination, feeling of incomplete bladder emptying, any pain or burning with urination, any blood in the urine, and any urinary urgency or incontinence. If you're coming for sexual health concerns, expect questions about erectile function, including the ability to achieve erections, the firmness of erections, how long erections last, morning erections, libido or sexual desire, ejaculatory function, and any pain with sexual activity. You'll be asked about your past medical history, including cardiovascular disease, diabetes, hypertension, high cholesterol, neurological conditions, previous surgeries, especially pelvic or abdominal surgeries, and any history of sexually transmitted infections. You'll be asked about all current medications, including prescription medications, over-the-counter drugs, supplements, and herbal products, as many medications affect urological and sexual function. You'll be asked about lifestyle factors, including smoking history, alcohol consumption, exercise habits, and diet. You'll be asked about family history of prostate cancer, bladder cancer, kidney disease, or other urological conditions, as family history significantly affects your risk. Be completely honest with all answers. Urologists have seen and heard everything, and accurate information is essential for proper diagnosis and treatment. Nothing you share will shock or surprise them. The symptom discussion with the urologist. After the initial history is gathered, you'll meet with the urologist who will review your information and ask additional detailed questions. This is your opportunity to describe exactly what you're experiencing and how it's affecting your life. Many men minimize their symptoms out of embarrassment, but this prevents your doctor from understanding the true severity and impact. Be specific and honest. If you're getting up 6 times per night to urinate and it's destroying your sleep quality and affecting your work performance, say so. If erectile dysfunction is straining your marriage and causing depression, say so. Urologists need to understand not just the physical symptoms, but the impact on your quality of life to recommend appropriate treatment. For urinary symptoms, your urologist might ask you to complete standardized questionnaires. The International Prostate Symptom Score, or IPSS, is a 7-question survey that assesses urinary symptoms and their impact on quality of life. You rate symptoms like incomplete emptying, frequency, intermittency, urgency, weak stream, straining, and nighttime urination on a scale from 0 to 5. The total score indicates symptom severity. 0 to 7 is mildly symptomatic, 8 to 19 is moderately symptomatic, and 20 to 35 is severely symptomatic. For erectile dysfunction, you might complete the International Index of Erectile Function, or IIEF, a 15-question survey assessing erectile function, orgasmic function, sexual desire, intercourse satisfaction, and overall satisfaction. These standardized tools help quantify your symptoms and track improvement with treatment. The physical examination. The physical examination is the part that causes the most anxiety for men, but understanding what happens and why makes it much less intimidating. The examination typically includes vital signs measurement, including blood pressure, heart rate, and weight, as these basic measurements provide important health information. Abdominal examination involves the urologist gently pressing on your abdomen to check for bladder distension, masses, or tenderness. This is completely non-invasive, and painless genital examination involves inspecting the penis for any lesions, plaques, curvature, or abnormalities. If you have erectile dysfunction, the urologist might check for Peyronie's disease plaques. The testicles will be examined for size, consistency, masses, or tenderness. This is standard examination that takes less than a minute and is not painful. The digital rectal examination, or DRE, is the part most men worry about, but it's a quick, important examination that provides valuable information about your prostate. Here's exactly what happens. You'll either lie on your side with knees drawn to your chest, or you'll stand and bend forward, resting your arms on the examination table. The urologist will put on a gloved finger, apply lubricant, and gently insert the finger into your rectum about 2 to 3 inches. The prostate gland sits just in front of the rectum and can be felt through the rectal wall. The urologist assesses the size of the prostate, the consistency. A normal prostate feels rubbery, while a hard or nodular prostate might indicate cancer, any asymmetry or irregularity, and any tenderness which might indicate infection or inflammation. The entire examination takes 15 to 30 seconds. Most men describe it as uncomfortable or awkward rather than painful. The key is to relax. Tensing your muscles makes it more uncomfortable. Is the DRE always necessary? For men over 50, especially those with urinary symptoms or elevated PSA, yes, it's an essential part of the examination. The DRE can detect prostate abnormalities that blood tests miss, and it provides information about prostate size that helps guide treatment decisions. For younger men coming for issues unrelated to the prostate like kidney stones or testicular concerns, the DRE might not be necessary. You can always ask your urologist why a particular examination is being performed. Legitimate medical professionals are happy to explain. Diagnostic testing. Based on your symptoms and examination findings, your urologist might order or perform diagnostic tests during or after your first visit. Common tests include urinalysis, where you provide a urine sample that's tested for blood, protein, white blood cells, indicating infection, glucose, and other abnormalities. This simple test can detect infections, kidney problems, diabetes, and bladder cancer. Urine culture might be ordered if infection is suspected To identify the specific bacteria and determine which antibiotics will be effective, post-void residual measurement uses ultrasound to measure how much urine remains in your bladder after you urinate. Normally, you should empty your bladder completely, leaving less than 50 milliliters. Elevated post-void residual indicates incomplete emptying due to bladder weakness or obstruction. Uroflowmetry is a test where you urinate into a special toilet that measures the rate and volume of urination. Normal peak flow rate is typically above 15 milliliters per second. Lower rates indicate obstruction or weak bladder contractions. PSA blood test or prostate-specific antigen is typically ordered for men over 50 or those with prostate symptoms. PSA is a protein produced by the prostate, and elevated levels can indicate prostate enlargement, infection, or cancer. However, PSA alone cannot diagnose cancer. It's a screening tool that indicates whether further investigation is needed. Normal PSA is generally below 4 nanograms per milliliter, though this varies by age. Comprehensive metabolic panel and other blood tests might be ordered to assess kidney function, blood sugar, and overall health. Imaging studies like ultrasound, CT scan, or MRI might be ordered based on your specific situation. For kidney stones, a CT scan is typically the best imaging. For prostate evaluation, transrectal ultrasound, or MRI might be used. For suspected bladder cancer, cystoscopy might be recommended. Cystoscopy involves passing a thin, flexible tube with a camera through the urethra into the bladder to directly visualize the bladder lining. This is typically done in the office with local anesthetic gel and causes discomfort, but not severe pain. It's the gold standard for diagnosing bladder cancer and other bladder abnormalities. Not all these tests will be done during your first visit. Your urologist will determine which tests are appropriate based on your specific symptoms and examination findings. Diagnosis and treatment planning. After reviewing your history, examination, and any initial test results, your urologist will discuss their assessment and recommendations. For many conditions, the diagnosis is straightforward. Urinary symptoms in older men with an enlarged prostate on examination typically indicate benign prostatic hyperplasia, or BPH, erectile dysfunction in a man with diabetes and cardiovascular disease, likely has a vascular cause. However, some conditions require additional testing before a definitive diagnosis can be made. Your urologist will explain what they think is causing your symptoms, what additional testing, if any, is needed, and what treatment options are available. This is your opportunity to ask questions. Come prepared with a list of questions you want answered. Don't leave confused or uncertain. Make sure you understand your diagnosis, why your urologist thinks this is the cause, what the treatment options are, including benefits and risks of each option, what happens if you choose not to treat, and what the expected timeline is for improvement. Richard's actual experience. Let me tell you what actually happened during Richard's first urology visit, which was so different from what he'd feared. He arrived at the office and completed standard paperwork, including medical history forms and a symptom questionnaire. A nurse took his vital signs and asked detailed questions about his urinary symptoms, which he answered honestly this time after years of minimizing them to his primary doctor. She collected a urine sample for urinalysis. He then met with me, and we discussed his symptoms in detail. I explained that his symptoms were classic for benign prostatic hyperplasia, prostate enlargement that's extremely common in men his age. I explained that we do a physical examination, including a digital rectal exam to assess his prostate. The examination took less than 5 minutes total. The genital examination was quick and non-invasive. The digital rectal examination, which he'd been dreading, took about 20 seconds. I felt an enlarged but smooth, symmetrical prostate consistent with BPH. There was no pain, just momentary discomfort. After the examination, Richard urinated into a uroflowmetry device, which confirmed a weak urinary stream. An ultrasound showed he was retaining about 150 milliliters of urine after urinating, indicating significant incomplete emptying. I ordered blood tests including PSA and kidney function. I then explained that he had moderate to severe BPH causing bladder outlet obstruction. His bladder was working hard to push urine through the narrowed channel, which explained his symptoms. I explained treatment options ranging from medications like alpha blockers and 5-alpha reductase inhibitors to minimally invasive procedures to traditional surgery for severe cases. Richard chose to start with medication, and we started him on tamsulosin, an alpha blocker that relaxes the prostate and bladder neck. I explained what to expect. Symptom improvement typically begins within a few days to weeks. Possible side effects including dizziness and retrograde ejaculation, and the importance of follow-up to assess response. The entire visit took about 45 minutes. Richard left with a clear diagnosis, a treatment plan, prescriptions, and a follow-up appointment scheduled for 6 weeks later. "I can't believe I waited so long out of fear," he told me at his follow-up visit, where his symptoms had improved by about 60%. The visit was straightforward, professional, and not nearly as uncomfortable as I'd imagined. I wish I'd gone 2 years earlier when the symptoms started. How to prepare for your first urology visit. Let me give you specific advice on how to prepare for your visit to get the most out of it. First, make a list of all your symptoms with specific details. Don't just say you have urinary problems. Note how many times you urinate during the day, how many times at night, whether you have difficulty starting, whether the stream is weak, whether you feel you empty completely. Be specific about erectile dysfunction. Can you achieve any erection at all? Is it firm enough for penetration? How long does it last? Do you have morning erections? When did the problem start? Has it progressively worsened? Specific information helps your urologist make accurate diagnoses. Second, bring a complete list of all medications, supplements, and vitamins you take, including dosages. Many medications affect urological and sexual function, and your urologist needs to know everything you're taking. Third, bring relevant medical records if you're seeing a new urologist. Previous test results, imaging reports, surgical records, and notes from other physicians provide valuable context. Fourth, write down questions you want answered so you don't forget them during the appointment. Common questions include, what's causing my symptoms? What tests do I need? What are all my treatment options? What are the risks and benefits of each option? How long until I see improvement? Will my insurance cover the treatments? And what happens if I don't treat this condition? Fifth, don't restrict fluids before your visit. You'll need to provide a urine sample, and being well hydrated makes this easier. However, don't drink excessive amounts right before. Arriving with an uncomfortably full bladder isn't necessary. Sixth, basic hygiene is important. Take a shower and clean yourself normally. You don't need special preparation. Seventh, avoid ejaculation for 48 hours before your visit if you're having a PSA test, as ejaculation can temporarily elevate PSA and affect the accuracy of results. Eighth, bring someone with you if you're anxious. A family member or friend can provide emotional support, help you remember information, and ask questions you might forget. Ninth, be honest and complete in your answers. Don't minimize symptoms out of embarrassment. Don't hide relevant medical history or medication use. And don't exaggerate symptoms to get specific treatments. Accurate information is essential for accurate diagnosis and appropriate treatment. Common concerns and misconceptions. Let me address common concerns and misconceptions about urology visits. Concern number 1, the examination will be painful reality. Most urological examinations are not painful. The digital rectal exam causes momentary discomfort, but not pain. Cystoscopy causes discomfort, but is done with local anesthetic. If something is truly painful during an examination, tell your urologist immediately. Concern number 2, the visit will be embarrassing. Reality. Urologists examine genitals and discuss sexual and urinary function all day, every day. Nothing you say or show them will surprise or embarrass them. They're medical professionals focused on diagnosing and treating your condition, not judging you. Concern number 3, I'll be diagnosed with cancer. Reality, while urologists do diagnose and treat cancers, the vast majority of urological complaints are not cancer. Most urinary symptoms in older men are caused by benign prostate enlargement. Most erectile dysfunction is caused by vascular disease, hormonal issues, or medication side effects. Even when cancer is found, early detection dramatically improves treatment success. Concern number 4. Treatment will require major surgery. Reality. Modern urology offers many treatment options for most conditions. Medications, lifestyle changes, minimally invasive procedures, and other conservative approaches are often tried before surgery. Even when surgery is necessary, many urological procedures are now minimally invasive with quicker recovery than traditional open surgery. Concern number 5. My problem is too embarrassing to discuss. Reality. Urologists regularly discuss and treat erectile dysfunction, premature ejaculation, penile curvature, genital lesions, incontinence, and every other urological and sexual issue you can imagine. What seems embarrassing to you is routine medical care to them. Concern number 6. I'm too old for treatment to matter. Reality. Quality of life matters at every age. Treating urinary symptoms, sexual dysfunction, and other urological issues can dramatically improve your daily life, sleep quality, relationships, and overall well-being, regardless of your age. What happens after your first visit? After your first urology appointment, you'll typically have a clear diagnosis or a plan for additional testing to reach a diagnosis. You'll have a treatment plan that might include medications, lifestyle modifications, physical therapy, scheduled procedures, or watchful waiting for conditions that don't require immediate treatment. You'll have prescriptions if medications are recommended. You'll have a follow-up appointment scheduled, typically in 4 to 12 weeks, depending on your condition and treatment. Follow-up visits are usually shorter and less involved than the first visit. They focus on assessing your response to treatment, adjusting medications if needed, reviewing test results that weren't available at the first visit, and monitoring your condition over time. Building a relationship with a good urologist means having an expert who understands your specific situation and can help you maintain urological and sexual health for years to come. The importance of not delaying care. Richard's biggest regret was delaying his urology visit for 2 years out of fear. During those 2 years, his bladder outlet obstruction progressively worsened. His bladder muscle thickened from working hard to push urine through the narrowed channel. The chronic high pressure in his bladder began affecting his kidneys. His quality of life deteriorated as nighttime urination destroyed his sleep and urinary urgency interfered with his work and social life. All of this was preventable with timely treatment. Research published in the Journal of Urology has documented that delayed treatment of BPH leads to progressive bladder dysfunction, increased risk of acute urinary retention requiring emergency catheterization, increased risk of bladder stones and infections, potential kidney damage, and reduced response to medical treatment as the condition becomes more advanced. The same principle applies to other urological conditions. Early detection and treatment of prostate cancer dramatically improves survival rates. Early treatment of erectile dysfunction prevents relationship damage and often addresses underlying cardiovascular disease. Early treatment of kidney stones prevents complications. Your action plan is simple. If you're experiencing urinary symptoms, sexual dysfunction, blood in your urine, testicular pain or masses, or any other urological concerns, schedule an appointment with a urologist. Don't wait for symptoms to worsen. Don't let fear or embarrassment prevent you from getting care. Understand that the visit will be professional, relatively brief, and far less intimidating than you're imagining. Prepare by documenting your symptoms, compiling medication lists, and writing down questions. Be honest and complete in providing information. Follow through with recommended testing and treatment. Attend follow-up appointments as scheduled. Take control of your urological health just as you would your cardiovascular health, your metabolic health, or any other aspect of your well-being. Richard's experience after treatment was transformative. Within 2 weeks of starting medication, his nighttime urination decreased from 6 times per night to 2 to 3 times. Within 6 weeks, his urinary stream had improved significantly, and he was sleeping much better. Within 3 months, most of his symptoms had resolved, and his quality of life had improved dramatically. "I got 2 years of my life back that I'd lost to symptoms," he said. "And I only got those years back because I finally overcame my fear and saw a urologist. My only regret is not going sooner. Don't let fear cost you years of quality life. Your first urology visit is a straightforward medical appointment that can identify and address issues affecting your health, your function, and your quality of life. Knowledge eliminates fear, and now you know exactly what to expect." Thank you for watching Men's Health 365. If you found this helpful, please like, subscribe, and share with men who might benefit from this information.